My name is Dr. Brenda Hoffman, and I'm a professor of medicine at the Medical University of South Carolina in Charleston. And I hate to admit how many years I've been in practice, but I did my education primarily in Kentucky, both undergraduate and then at the University of Kentucky College of Medicine. I actually came to Charleston thinking that I was going to be here for 1 year because originally I had thought that I might want to do ENT surgery, and all of my friends in ENT said, you need to do a year of medicine, which sounded like the kiss of death, but they thought that it would help me to manage problems of bleeding and high blood pressure and such. So I did that, and the first 3 months that I had in Charleston, I had attendings that were all gastroenterology. And I thought, wow, these people really enjoy what they're doing. And as I started to work with them, I realized that what they were doing felt right for me. The first 3 months that I had in Charleston, I had attendings that were all gastroenterology. And I thought, wow, these people really enjoy what they're doing. And as I started to work with them, I realized that what they were doing felt right for me, because I like to use my hands and as well as my head, and this gives me a way to do that. My focus at the university is primarily in gastrointestinal malignancies, but I also do a good bit of work in staging lung cancer. That has come about because of some instrumentation that I saw in 1988 when it was just being developed. That's called endoscopic ultrasound. When I was looking at it, I thought, that is really something, and it should have a broad range of application. But when I went looking for jobs, everyone said, that's kind of nifty, but we don't know where it's going, and it costs a lot of money. So basically, I decided to stay wherever they would buy me the equipment, and that happened to be at this university. So I've been here ever since, developing endoscopic ultrasound. It's been a fabulous potential for me because I was in on the development of many of these types of prototype equipment. And we've been able to change patient management over the years, in particular for certain cancers like esophageal cancer, and within the last few years, more interestingly, in lung cancer, which you would think wouldn't apply to GI persons, but it very clearly does. My philosophy for patients is really to treat them like my family. And that's also the way I analyze the literature. When I'm looking at treatment options or algorithms of patient management, I look at them as to whether they make sense for my patients and whether there's enough evidence to support the pattern that we're using. So I like to think of everyone as a member of my family and decide whether I would choose that for that individual. We take a multidisciplinary approach to everyone, so it's just not my opinion on how you might be managed or what the best options are. In particularly difficult patients to come up with how they should be treated, it's best to have multiple minds of having input, and we take that approach here. We also have the latest in technology, which is usually a good thing, and we try to use that to do the very best that we can for all of our patients. I try very hard to get home because I am a family-oriented person. I have one child, and lately all of my hobbies have seemed to have gone by the wayside because I spend my time taking care of family, children in the neighborhood, and also some dogs that we have, some new puppies. So I have a busy life, but it's a lot of fun.
For more information about this physician or services at the Medical University of South Carolina, call 1-888-792-4990 or go to muschealth.com.